When it comes to breast and endometrial cancers, two of the most common hormone-sensitive malignancies in women, dietary choices can influence risk in ways that are both subtle and profound. These cancers are strongly tied to the body's hormonal milieu, particularly the levels and activity of estrogens, and food interacts with that system through multiple mechanisms: metabolism, body fat regulation, insulin signaling, inflammation, and even direct modulation of hormone receptors. While no single food or diet guarantees protection or causes cancer outright, the cumulative impact of dietary patterns over time can tilt the balance toward health or disease. Yet much of the popular advice women receive is oversimplified or even dangerously misleading. One of the most important and overlooked connections is between body fat and estrogen exposure. Fat tissue is not inert. It's hormonally active, especially after menopause, producing estrogen via the enzyme aromatase. This means that excess body fat increases circulating estrogen levels long after the ovaries stop producing it, elevating the risk of both breast and endometrial cancers. Obesity is also linked to chronic inflammation and insulin resistance, both of which further contribute to cancer-promoting environments. Unfortunately, diet culture often emphasizes weight loss without considering nutritional adequacy, and some women may adopt extreme or unbalanced eating patterns in the name of cleansing or balancing hormones, ironically increasing risk through nutrient deficiency or metabolic stress. Dietary fat composition also plays a role, though its influence is nuanced. While total fat intake doesn't consistently correlate with increased cancer risk, the type of fat does. Diets high in saturated fats, especially from processed and red meats, have been associated with higher risks of breast cancer in some observational studies, while polyunsaturated fats from fish and nuts may be protective. However, much of the evidence remains conflicting, in part because dietary recall is notoriously unreliable and because other lifestyle factors often coexist with poor fat quality, such as low fiber intake or high alcohol consumption. Phytoestrogens, particularly those found in soy, are another source of confusion. These plant-based compounds can weakly bind to estrogen receptors and were once feared to stimulate hormone-sensitive cancers. However, large-scale studies, particularly from Asian populations where soy is consumed regularly in minimally processed forms, suggest that moderate soy intake may actually be protective, especially when started early in life. The concern arises mostly with isolated soy isoflavones in supplements, which may not behave the same way in the body and have not been studied as rigorously. Still, many women avoid soy entirely based on outdated or misinterpreted findings, potentially missing out on its fiber, protein, and antioxidant benefits. Alcohol is a more clear-cut risk factor, though it's often downplayed or dismissed. Even moderate alcohol consumption, just 1 drink per day, has been shown to increase breast cancer risk, likely through its impact on estrogen metabolism and DNA damage. For endometrial cancer, the evidence is less consistent, but there's no health justification for alcohol in this context. Yet alcohol continues to be marketed as part of an aspirational lifestyle, particularly to women, while its carcinogenic properties remain poorly understood or intentionally ignored by consumers and influencers alike. Dietary patterns that emphasize whole, minimally processed plant-based foods, like the Mediterranean or DASH diets, appear to offer the most consistent protection. These diets are rich in fiber, antioxidants, phytonutrients, and healthy fats, and they support healthy weight maintenance without requiring severe restriction. However, following these diets requires access, education, and consistency, 3 things not always available to women navigating cancer risk or survivorship. Moreover, the popularization of hormone reset diets or influencer-promoted detoxes can lead women away from evidence-based strategies toward expensive and proven or restrictive regimens that offer false hope and real harm. The timing of dietary exposure also matters. Evidence suggests that nutrition early in life, during puberty and adolescence, may influence lifelong risk by affecting breast tissue development and hormonal programming. This raises important questions about how early dietary interventions might reduce cancer risk decades later, but again, these insights are often lost in public discourse, which tends to focus narrowly on adult weight loss or short-term fixes. For women at high genetic risk, such as carriers of BRCA mutations, diet may not prevent cancer outright, but it can still influence modifiable risk factors, quality of life, and response to treatment. Unfortunately, too many are told there is nothing they can do beyond surveillance or surgery, when in fact nutrition can be a valuable component of risk reduction and survivorship care. But it must be personalized, realistic, and integrated with professional guidance, not based on fear or misinformation. The link between diet and hormone-sensitive cancers is real, but it is not a simple equation of eat this, not that. It involves complex interactions between metabolism, body composition, genetics, life stage, and social context. Women deserve clear, science-based guidance, not rigid rules, guilt-based messaging, or influencer-driven pseudoscience. The most protective approach is neither extreme nor expensive. Eat a variety of whole foods, maintain a healthy body weight, minimize alcohol, and avoid over-reliance on supplements or dietary fats. Hormones are powerful, but they don't act in isolation, and neither should your diet.